found Dr. Manchanda here. Possibly, if he's here, he would be able to tell us a lot more on the economics of it with regard to veterinary diagnostics. I'm Dr. Madhavan, and I have with me Dr. Shibu, who is a veterinary gynecologist, and we are from the College of Veterinary and Animal Sciences at Trichy in Kerala. With regard to the clinical scenario, I'm sure this is a totally different field from what you have been listening to. From the clinical scenario, we have possibly can be broadly divided into three sectors: the large animal sector, the companion animal care sector, and the equine and the exotics. Of course, with regard to treatment, broadly, if you divide the farm animal treatment and the pet animal care, you would find that the large animal treatment or the farm animal treatment is to a great extent based on government institutions. And the pet animal care, especially with regard to cosmopolitan cities, primarily depends on private veterinarians. This would be a broad classification. Of course, there would be exceptions. With regard to pet ownership or pet parenting, there has been a phenomenal increase in pet parents during the COVID times, and it is predicted that from a population of about 19.3 million of pets in 2018, we are to reach about 31 million by 2023. So that is not restricted to huge cities. You find such a change occurring in Tier 2, Tier 3 and even Tier 4 cities. With regard to diagnostics, maybe are broadly divided into the laboratory support that we require and the imaging support that is required. Okay. Maybe if you want to use the term laboratory veterinary medicine, we don't use it much anyway. Maybe we use the term clinical pathology more than veterinary laboratory medicine. So if you start off with the basics of it, a hematology machine, we used to depend, maybe even during my earlier times as a teacher, we used to depend on human machines to a great extent, and we now have dedicated veterinary machines which require specific software for different species. Of course, these facilities are few, and I think there is a potential in that sector. This slide would probably explain why we would require more specific hematology machines. Maybe you have the alphabet till B here, W, E, W, X, Y, Z. Maybe 3 are missing, which means that there's a huge difference in the morphology with regard to the maybe with regard to WBCs, RBCs, and hence definitely specific machines is the need of the hour. Okay, with regard to biochemical analysis, of course, very many small clinics would be depending on human machines, human laboratories to a great extent. The issue would be that there are several tests which are species specific, right? Even from C-reactive protein, HbA1c to some of the cardiac tests also. And for specific diseases like pancreatitis and exocrine pancreatic insufficiency, the tests required are totally different. And whenever you are sending it to a human lab, especially with regard to even routine biochemistry analysis, naturally you would be getting the normal range printed in it, which would be of human beings. Of course, for a small time or a clinician in a smaller place, they would naturally require a natural normal range for the animal range or of that species being printed. Okay, with regard to pathology and microbiology, we have very limited private sector veterinary microbiologists or pathologists, especially in smaller towns. Even in a place like Cochin, because where we have had a boom in the number of hospitals and pet parents, we find that the laboratory facilities are extremely limited. And again, very many of us would be depending on the human laboratories. And when we get the results, of course, we would require a veterinary pathologist or microbiologist to make the interpretation. So possibly there is a good possibility of growth in that sector. Okay. With regard to the imaging, we are basically restricted to a great extent on radiography and ultrasonography. CT, MRI, possibly a dedicated CT machine for animals is maybe about 300 kilometers away from here. So that is not very practical to do this kind of imaging. This picture is from our hospital, and a scan being done And the other picture on the other side, a radiograph being done or a dog being set up or maybe prepared for a radiograph is from a small place quite away from here called Maraman, which would suggest the need for such facilities even in smaller towns. Okay. As I said, there is definitely a need for such establishments. It would, from the commercial point of view, also it is great, and also from the point of view of veterinary, it's also very important to get good results for better interpretation and better treatment. Okay, what are the challenges ahead? Of course, we need such establishments. Then accreditation is a question, and can we go by specific standards set for the medical community or for the medical labs? It's also a question that can be discussed. And of course, we need dedicated manpower. Veterinarians are required, veterinary microbiologists would be required, pathologists would be required. We have a separate wing called veterinary parasitology also. Maybe those people would be required. And I'm sure Caho might have a role to play with regard to all this, with regard to laboratories, veterinary laboratories, maybe with regard to even veterinary clinics, veterinary hospitals. How do we classify them, whether we can apply the same kind of standards? Maybe if Caho comes into play a role, I'm sure that we would have better standards of healthcare in the veterinary sector. Of course, this is one block of our University Veterinary Hospital at Manuthi Trichure in Kerala. We have a couple of laboratories. We have an NABL accreditation for specific tests, and we have been cooperating with the government in providing COVID testing also from one of our university laboratories. Of course, this is with regard to our university or our hospital where we can push a lot of infrastructure, or maybe we can make sure money comes in. But whether that would apply to all the private sector hospitals in the state or possibly in the countries, again a question. Laboratory facilities are required. Maybe okay, we can discuss on it. I'm quite thankful to Dr. Aruna for calling us, Dr. Aruna, I'm sorry, for calling us over, and Dr. Avinash also for calling us over. Oh, thank you.
So thank you, both of you, and we have some questions, and we have. I have a veterinary lab in Bombay, and when we did that, as Sir said, initially, say around 2004, we started getting samples, and that time we were not aware. I think all of you must have faced who are running independent setups, that there are samples but the analyzers are human, and at time you get turtle or where you have nucleated RBCs, those samples, and that time the awareness was very, very hardly anything. So now with the diagnostic companies stepping in, and as you rightly said, the pet population gone up. I think we had a chat and we discussed. What we are seeing is not only pathology, that means hematology, biochemistry, clinical, parasitology, FNSE, USG guided, vaginal cytologies for gynecologists. We are also having a veterinary parasitologist, a pathologist, a veterinary microbiologist, and the amount of information which comes out is immense. Now my question to you is, you answered it partly, that is there a standalone veterinary lab where you practice at Trichure or Cochin? Is there any? Because I think when me and Avinash we were discussing, we tried to look at the Google and do some research. Yeah, some of the clinicians are having machines inside their clinics and they are running the sample and giving it without the morphology or the parasitology. So I think there is one input which I need from you, and then the next question.
With regard to laboratory facilities, we are talking about Kerala. We don't have a specific veterinary laboratory asset, possibly at least till maybe till about 2020. We now have one laboratory which has come up near Cochin,
Okay.
and several of the bigger hospitals which have come up in Cochin and some in Trivandrum have their in-house facilities. But for a clinic, maybe for a clinician who has set up a small veterinary clinic or a pet clinic, it is extremely difficult to push in more money into the sector with regard to the laboratory facilities.
Yeah.
So he would definitely require separate dedicated labs, or maybe a facility which is attached to a human lab also, but specifically again dedicated to the veterinary facilities there, veterinary samples. Again, maybe the quality has to be assured. That definitely is there. Maybe we don't have any, as far as I know, specific accreditation standards. Maybe we would require that.
Yeah.
For a place like Cochin, or it's probably the biggest cosmopolitan city in Kerala, we do not have a specific dedicated lab for this purpose. I think there is scope for it, and there is definitely a need for it also.
I'm sure there is scope. That's the reason we have troubled you to come over. And, yeah. Yes, sir.
Yes, I would like to add a few points, because in Cochin actually they have a lab called IBET lab, and they have a plan to establish to all the 14 districts of the state. So likewise, there are some plans, and within a couple of years there will be a big change. That is what we also assume. And the quality of labs are also very important, because there are not many zoonotic diseases, and wherein the pinpoint diagnosis is of very important, especially for example, all of you are aware of rabies, where you need a fluorescent test or something like that. So for all these, we need specific labs where we can get full proof.
Okay. My next question, since all of us have been talking only about pandemic, because that is what our life to stand still. Just 3 months back, we experienced, this is out of experience, that we started COVID PCR for animals under validation from UK. We did couple of tests, and I also heard from you some tests were done in your college. So the biggest question which came to us from our pet parents, if that dog or a cat, because it's primarily companion animals, gets COVID, then what do we do? Who do we isolate? Who do we quarantine? And there was, and we approached our Vice Chancellor of Veterinary University, but there were some answers which were still unanswered, I'm sure. But what was your experience in that, since you belong to a institute, I'm sure you will have better norms and governing bodies. And did you perform, did you get a chance to do a veterinary PCR for your animals who are admitted? And if yes, how was the experience? Was there any positivity?
We have not done any test for COVID with regard to our pet animals as such.
Okay.
I think what is recognized is that the possibility of transmission from a pet to a human being is extremely low. I think that is what is recognized.
Okay, okay. Coming to radiology, sir, we have seen, at least in the state of Maharashtra, I am not aware of Kerala, veterinary USGs. I think the role of Caho, I mean, which we discussed internally. When we look at veterinary USGs, even PCPNDT is required in veterinary USG centers. Is that true?
Yes, absolutely true. Because in Kerala, in some of the districts, they are making it compulsory. For example, in Trichy, where we have our university, veterinary college and all, it is compulsory. And most of the private places wherever they are doing ultrasonography, PNDT is mandatory. Whereas in some other districts, they say for veterinarians it may not be required because you are not scanning any ladies, so it is not necessary. So there is a confusion, but it all depends on the DMO. That is what right now I can say.
Okay. Coming to role of Caho, you know, we did a lot of reading before all this. There is ISO 17025, which most of us who started accreditation way back in 2000 know. I think there is we have the pioneer sitting there who can tell us about veterinary accreditation. So please.
Okay. It's very nice to listen to you. Very happy to know your concern towards animals. On medical testing, human tissues or in vitro diagnostics, we have the standard 15189. That is the standard. For animals, for all other testing, food testing, animal testing, the standard is 1702. 17 is the group, 25 is the guide. 0 is generally applicable to any testing. Earlier it was applicable to medical testing also. Now medical testing has separate standard, 15189, and 1 is not. Individual diagnostics are human tissue. What I would like to tell you, with regard to veterinary, accreditation is not it's new for veterinary labs. Karnataka government, veterinary department, have decided to get all their veterinary laboratories accredited as per 1705. They are all trained also. Now, already 2 major centers for rabies testing and one more at Bangalore, they are accredited as per 1705. Now, there are something like 32 diagnostic centers in Karnataka are going in for veterinary, poultries, farmhouses where they have to have a laboratory to detect certain antibiotics or pesticides and things like that. They are going in for that. There is also a thinking at the national level to make it mandatory for at least the government established veterinary labs to go in for accreditation. And standard is 1702. And it is easy within 3 months one can go in for. It's not difficult. Standard is now 17025 or 2017 version, which is based on ISO 9001-2015. If your laboratory or if your organization is already 9001-2015 certified, then your job is only 50%, only for technical requirement. Another difference between medical testing and veterinary testing, in medical testing, the more importance is given to the competence of people to use all the resources. In veterinary, it is the same equipment, there is no difference. Same instrument, same hematology analyzer, same instruments can be used, but the person who is using should be competent. That means you people must decide what is the competence level. It is very important. Now, all these days, we have only NABL doing this accreditation, but now there are many more accreditation bodies which have come.
So, thank you.
Question to you just. Sorry to interrupt. Sir, is there anything for our laboratories also to club these two things? Like if you have one level accreditation like 9001, 9002, can another level, the lab can be exempted for something?
Yes. If the laboratory is already certified as per 9001-2015 in the ISO 15189 assessment process, management system is now next version of ISO 15189 is released on 1st November this year, 2022. Very clearly says A, plan B, option A, option B. If you are already certified, you don't have to go in once again for that documentation, verification, validation, only technical requirements. It is made very clear, and laboratories like now Dr. Aparna has a laboratory, it's for human testing. She can also have animal testing in that center, provided that facilities are accredited as per 1702. Same instruments, but they can get one for accreditation for human tissues, in vitro, another for animal tissues.
Thank you, sir.
So that was Dr. Venkatesh Tupin sir, and when we are going to take this discussion ahead, he is always with us. So we are sure that at least we'll start some movement in this and invite this stream as a part of Caho, because I think that was the whole idea when me and Dr. Avinash and Dr. Vinita we discussed to include veterinary into this.
Very good. Veterinary fishery focus.
Yes. Absolutely. And one more exciting thing which I didn't mention, I said about HEMAT, biochemistry, serology, COVID RT-PCR, because I have myself gone under this process. Veterinary microbiology, even that is something which they require, and communication, which I think all of us have been talking. So, it's just an eye-opener for when I have Dr. Om Manchanda here, there is humans labs which we have seen, but another big opportunity which will be helping the pet parents and the way this market is growing. We have seen, I think when I was in one of your conferences, and I saw different analyzers, sir. We did see different analyzers. So I think it's a market open to explore. It's a completely untapped market. And I really want to personally thank both of you for actually accepting our invitation and coming into this forum of human diagnostics. And yes, we'll go back to Caho to open this small window and start working with you all for education and getting your fellow veterinary pathologists, microbiologists and clinicians to develop this. Thank you.
And we have one comment from Dr. Om Manzanga. He has an experience of veterinary.
Yes. So I mean, I was super thrilled when I read that he is a veterinarian. So great.
Yeah, I think some of you may not have read my profile carefully, but I am actually a vet by profession. So we have started PathVet as a division for veterinary pathology. I think we are just adding one lab in Chandigarh also. We'll have 3 labs. So though it's a very small business, but I think with veterinary background, and Dr. Lal keeps telling me that you must do something for this field. I'm very passionate about it. And though I never practiced as a veterinarian, but I did work, I have worked in many streams, like I have been very close to poultry farming. I used to work with Hindustan Liver in their poultry feed business. So I have lots of experience with poultry farmers as well. And actually my brother also is a vet, so we are a family of veterinarians. So I think it has a lot of scope, and I wish you all the very best. And happy to see at least both being discussed together. I think eventually there is no difference between the two, right?